There's a silent health issue affecting millions of older adults over 65 across Europe and North America, and most have no idea it's happening. Fatigue, memory fog, mood swings, even frequent falls, all may stem from the same hidden cause, a simple vitamin deficiency. It's the most common one among seniors, yet it's rarely tested for, rarely talked about, and too often dismissed as just aging. But what if it's not? In today's video, we'll explore this overlooked danger, reveal why it matters for your senior health, and share real-life elderly wisdom that could change how you take care of yourself after 60. If you value life lessons from the elderly and want more inspiration, don't forget to subscribe and turn on the bell for updates from Elderly Reflections. Vitamin B12 deficiency is the most common and most underdiagnosed vitamin issue affecting older adults across the United States and Europe. It's often called the invisible deficiency because its symptoms are subtle, gradual, and often mistaken for aging itself. But let me be very clear, B12 deficiency is not just a minor nutritional oversight. It's a condition that can mimic dementia, rob seniors of their mobility, and reduce quality of life in ways that are completely avoidable. If you're over 60 or you care for someone who is, this is something you need to understand not in theory, but in a deeply practical and personal way. Let's start with the science. Vitamin B12, also known as cobalamin, is an essential nutrient responsible for producing healthy red blood cells, supporting nerve function, and maintaining brain health. It's not produced by the body and must be absorbed from food, mainly from meat, dairy, eggs, and certain fortified products. Now here's the problem. As we get older, our ability to absorb B12 decreases. Even if our diet doesn't change, the lining of the stomach thins with age. The amount of stomach acid we produce drops. And without adequate acid, B12 can't be separated from the protein it's bound to in food. That means even a person who eats 3 square meals a day, filled with all the right nutrients, can become dangerously deficient. Medical studies suggest that between 15 to 20% of adults over the age of 60 have some level of B12 deficiency, and the numbers increase dramatically past 70. In long-term care homes and senior living communities, it's not uncommon to see 1 in 3 residents with symptoms that can be traced back to low B12 levels. The symptoms themselves are tricky. They are not sudden, they're not dramatic. They're slow and quiet. Seniors might feel more tired than usual. They may start forgetting things. They might complain of numbness in their feet or struggle with balance. At first, these changes are easy to brush off. After all, everyone expects to slow down with age. But here's the truth. Slowing down isn't always just about getting older. Sometimes it's a signal. Sometimes it's your body whispering that something deeper is wrong. Let me walk you through what happens when B12 runs low. First, your blood starts to change. Without B12, your body can't make red blood cells properly. That leads to a form of anemia that leaves you exhausted no matter how much you sleep. Your skin may appear pale. You may feel short of breath after climbing just a few stairs. Then the nervous system begins to suffer. The protective coating around your nerves called myelin starts to break down. That's when you get the tingling, the numbness, the pins and needles in your hands and feet. Over time, this nerve damage can become permanent. It can lead to instability, missteps, and falls. And for seniors, one bad fall can change everything. Loss of mobility, long hospital stays, even loss of independence. But perhaps the most frightening aspect of B12 deficiency is what it does to the brain. Low B12 has been linked to memory loss, depression, irritability, and even psychosis. Studies from Harvard and Oxford have found correlations between low B12 and brain atrophy, literal shrinkage of brain tissue. Many seniors diagnosed with early-stage dementia may in fact have a reversible condition caused by B12 depletion. That's not speculation. That's documented peer-reviewed science. And yet very few routine medical checkups include B12 screening unless a doctor is specifically looking for it. Now let's talk about what makes this worse. Medications. Some of the most commonly prescribed drugs for seniors directly interfere with B12 absorption. Proton pump inhibitors like omeprazole or lansoprazole, used for acid reflux, reduce stomach acid, the very thing you need to unlock B12 from your food. Metformin, a go-to medication for type 2 diabetes, has also been shown to reduce B12 levels when used over a long period. Even antacids, taken daily or as needed, can interfere with B12 uptake. These aren't rare cases. Millions of older adults are on one or more of these drugs, often for years, with no awareness of the impact on their nutrition. Take the case of Gloria, a 75-year-old woman living in Toronto. She had been on acid reducers for chronic heartburn for nearly 6 years. Over time, she noticed that she felt foggy and tired. Her fingers would go numb. Her doctor initially attributed it to aging and arthritis. But during a routine blood test, a nurse practitioner ordered a full vitamin panel, and the results came back. Her B12 was severely deficient. She began a course of weekly B12 injections, and within a month, her energy returned. The numbness faded. Then there's David, an 80-year-old retired postal worker from Scotland. He was an avid walker, known around the neighborhood for his daily 5-mile loops. But over the course of a year, he began to lose his balance. He started falling on flat ground. He couldn't figure it out. He'd never had leg problems. When he finally saw a neurologist, tests revealed nerve damage from long-term B12 deficiency. His blood work showed that he had been just under the normal threshold. Not alarmingly low, but low enough to cause damage over time. With B12 injections and physical therapy, David slowly regained control over his steps, though not all of the nerve damage was reversible. There's also a pattern with diet. Many seniors, either for health reasons or due to financial constraints, begin cutting back on meat and dairy. Plant-based diets, while often beneficial for heart health, don't provide natural sources of B12. Unless seniors are eating fortified cereals, nutritional yeast, or taking supplements, they're at risk. Even seniors who do eat meat may be consuming far less than they used to, or preparing meals that are simpler and less nutrient-dense. In senior community kitchens across the U.S., nutritionists often report that lunch trays are filled with oatmeal, toast, canned soup, easy to chew but light on essential nutrients like B12. And when B12 is tested, there's yet another problem. Interpretation. The standard normal range for B12 in the blood varies by lab, but most define deficiency as anything below 200 picograms per milliliter. However, many people begin experiencing symptoms at levels between 200 and 400, what doctors call low normal. Unfortunately, if you fall in this gray zone, your symptoms might be delayed. In functional medicine circles, practitioners often aim for levels above 500 to ensure optimal neurological function. You might be wondering, well, if this is so common and dangerous, why aren't we hearing more about it? That's a good question. Part of the answer is that B12 deficiency doesn't scream. It doesn't create an emergency overnight. It creeps. It's subtle. And it mimics the natural aging process so well that it rarely raises red flags. Unless someone is specifically looking, another reason is that it's easy to treat once found. A few injections, a daily supplement, a change in diet. In the grand scheme of medical crises, B12 deficiency doesn't make headlines, but in the world of everyday senior health, it quietly takes away quality of life, slowly, steadily, and in many cases needlessly. The lesson here is simple. Don't wait for the symptoms to become obvious. If you're over 60, especially if you're taking any long-term medications, it's worth asking your doctor to check your B12 levels. The test is inexpensive, the treatment is safe, and the impact it can have on your memory, energy, mood, and mobility is profound. This is what Elderly Reflections are all about. Taking the wisdom of those who've lived through it and using it to protect those just entering this stage of life. Aging should not mean confusion. It should not mean exhaustion. And it certainly should not mean falling in the dark when all you needed was a bit of light. One of the most troubling aspects of vitamin B12 deficiency in older adults is not just how common it is, but how often it goes unnoticed. You might think with so much medical knowledge and testing available today, something as important as a vital nutrient wouldn't be missed. But it is, not just by doctors, but also by families, caregivers, and even seniors themselves. This happens for a number of reasons. Some medical, some cultural, and some purely human. Let's begin with how easily the symptoms of B12 deficiency can blend into the normal experience of aging. Feeling tired, a bit forgetful, unsteady on your feet, not quite yourself emotionally. These are all things people expect as they grow older. Seniors are told again and again that it's natural to slow down, that it's expected to forget names, lose some energy, or sleep more. But sometimes these signs aren't aging, they're warnings. And if we mislabel them, we miss the chance to intervene. It's a mistake that can cost someone their independence, their mental sharpness, even their ability to walk. Doctors, too, are under pressure. In many countries, especially in public health systems like the NHS in the UK or Medicare-based care in the US, appointments are short, 10, maybe 15 minutes. That's barely enough time to discuss blood pressure and medications, let alone dive deep into vague symptoms like, I feel off, or I've been more tired lately. Unless a doctor is trained to think of B12 deficiency or reminded by the patient, it might not be tested at all. And if it is tested, there's the issue of the reference range. Like we touched on in the last section, most labs still use outdated thresholds for deficiency. That means a senior could have clear symptoms, low normal B12 levels, and still be told they're fine. Then there's something even harder to talk about. Pride. Many older adults are deeply independent. They've spent their lives working, raising families, solving problems. Asking for help or admitting that something feels wrong is not always easy. In fact, some seniors downplay their symptoms to avoid being seen as a burden. They don't want their children to worry. They don't want to be that old person who complains all the time. So they say they're just tired. They laugh off forgetfulness. They get used to walking slower, sitting more, and doing less. All the while, something very real and very treatable is quietly getting worse inside their body. There's also a generational mindset to consider. Many seniors, especially those over 70 or 75, grew up in a time when people didn't run to the doctor for every ache and pain. You toughed it out, you waited things out. That mindset, while admirable, can also delay the kind of testing and treatment that would make a big difference in their later years. One retired Navy veteran in Florida said it best, "When I was younger, if something hurt, you worked through it. But now I realize some things aren't meant to be ignored. Sometimes it's not just age catching up, it's a signal." Family members and caregivers also play a role, and not always intentionally. Adult children may not live nearby. They may call once a week or visit once a month. They hear mom say she's tired, or grandpa forgets something small, and they brush it off. He's just getting older. Or worse, they get frustrated. They tell their parent to focus, or to try harder, or to be more positive. In reality, their loved one may be struggling with symptoms beyond their control. Symptoms caused by a lack of a nutrient that no one thought to check for. This is something we've heard repeatedly in senior health support groups. A woman named Carol, 69, shared her experience at a community center in Oregon. "My daughter thought I was depressed. I thought I was just worn out, but it turned out I had a B12 level of 190, and I had all the symptoms. Fatigue, mood swings, tingling in my feet. I started supplements, and it felt like waking up after a fog." Stories like Carol's remind us that sometimes the solution isn't complicated, it's just overlooked. Healthcare systems don't make it easier. In many places, B12 testing is not part of standard blood work unless requested. And even when it is, treatment options can be inconsistent. Some doctors prefer injections, others suggest high-dose oral tablets. Some insurance plans won't cover preventive testing at all unless there are extreme symptoms. For seniors living on a fixed income, that matters. If something isn't covered, it often isn't done. There's also confusion around treatment. While B12 injections are highly effective, they require frequent trips to the clinic, especially in the beginning. For someone who lives alone, doesn't drive, or has mobility issues, that can be a barrier. Oral supplements are easier, but not all forms are absorbed equally. Cyanocobalamin, the most common and cheapest form, isn't always well tolerated. Methylcobalamin or sublingual drops can be better, but they cost more and aren't always recommended. Seniors often don't know the difference, and few doctors have time to explain it in detail. Another layer to this problem is that many elderly people trust that if something was truly wrong, it would have shown up already. They think my doctor would have told me. But that trust can be misplaced, not out of negligence, but out of the sheer volume of things doctors are expected to monitor. With so many priorities, blood pressure, cholesterol, diabetes, arthritis, fall risk, something like vitamin B12 can fall through the cracks. Even in senior living facilities, where nutrition is carefully monitored, residents are still at risk. A dietitian at a care home in New Jersey shared that many residents start declining even with full meals provided. When they checked, they found widespread low B12, despite well-balanced diets. The culprit? Poor absorption, long-term medication use, and insufficient fortification in the food supply. As she put it, they were eating, but their bodies weren't receiving. So what's the answer? Awareness is the first step. Knowing that B12 deficiency exists and that it can hide behind normal aging symptoms changes the conversation. Seniors need to be empowered to ask for B12 tests, not wait for someone else to suggest it. Families need to know the signs. Unusual fatigue, mood changes, numbness or tingling. balance problems, mental fog. Healthcare providers need to rethink the assumptions about what's normal in older adults. And we as a society need to stop accepting decline as inevitable, when some of it is preventable. The elderly still have so much wisdom, clarity, and presence to offer. But they can't do that if their minds and bodies are slowly being undermined by something we refuse to see. It's not just about vitamins. It's about dignity. It's about independence. It's about preserving the ability to walk, to remember, to speak clearly, to enjoy each day with energy and purpose. There's a quote I once heard from a senior in Pennsylvania that stuck with me. He said, "We don't age from the outside in, we age from the inside out." That's the essence of this issue. What's happening inside on a cellular, nutritional level matters just as much, if not more, than what we see on the outside. When you take care of the inside, the outside follows. So if you or someone you love is over 60, take a moment. Don't just ask how they're feeling. Ask how they're functioning. Are they more tired lately? Have they fallen more often? Do they seem forgetful in a way that feels new? These are not just signs of aging. They might be symptoms of something much simpler and entirely treatable.